gives me immense pleasure to be part of the Face Forward 2025. I'd like to begin. The topic given to now the HDMI is in place. So it gives me immense pleasure to be part of the Face Forward. And today the talk is going to be about a vague topic as far as I can see, automation and robotics in oral implantology. In the current era, we have already come to terms with two contrasting phrases. One is virtual reality and artificial intelligence. So when you can come to terms with contrasting words like this, I'm sure we'll also get comfortable with automation and robotics in a line of work. So to make this a little more interactive and engaging, I have with me Dr. Suresh, our senior and colleague and friend of mine. So we thought we'll take this like a conversation about the topic. Good morning, Dr. Suresh.
Good morning, Sri. Thank you.
So from this topic, I can see that the only term familiar for me is oral implantology.
Correct.
What is your take on that?
I too sail in the same boat because we are all familiar with basics mainly, but you know, the automation is becoming more and more important in all the fields, including dentistry. So it is almost inevitable. Whoever is following dentistry, we need to know what is automation. We need to know where robotics can be used so that we can catch up the developing technology.
So Dr. Suresh, can you just tell me what automation is?
Yes, the name implies automation is making something happen automatically. That is, the use of machines, technology, and or software to perform the tasks with minimal or no human intervention at all. So it's all about to streamline the processes and to improve the efficiency and to reduce the chance of human error and fatigue. That's automation.
Okay, so we have another term in our topic which says robotics. How is it different from automation?
Yeah, the automation is a concept. Robotics is execution. That is, robotics is a beautiful branch that combines engineering, computer science, and imagination that will create machines called robots and that can perform tasks that are traditionally done by us, that is human beings. It is not only just to have some playful gadgets, it's more important to develop systems that can sense, think, and act to reduce our workload and fatigue. Robotics involve mainly three components. The first one is mechanical systems. They are all incorporated with mechanical systems which will have arms, wheels, and joints, and that will let a robot move and interact with the world. It is almost like hands of the human beings. Second part is your electrical systems which will have motors, sensors, and circuits that will power the robot to see what is happening around it. This is like eyes of the human beings. The last part is software. It is like brain of the human being, and the software is the brain of the robot, which is built by algorithms and code that will tell the robot what to do and how to respond. That's robotics.
Okay, that's great. So I think, am I right if I say mechanical systems, electrical systems, and software are the three pillars of robotics?
Obviously, yes. Even if one is less, robot doesn't work.
All right, so this is something where we have to understand the three systems, because this will come in play all through the presentation on how these three systems are integrated for us to use robotics effectively in our fields. So, Dr. Suresh, it seems far-fetched. Do you think robotics and automation has already influenced our field, or is it yet to be?
No, Sri, it is already there. I think we are only lacking the knowledge and how to use the robotics in dentistry. Like other industries like automobiles, construction, agriculture, robotics has entered dentistry already. It is being there for quite a long time. especially in the areas of diagnosis in dentistry, to plan the treatment in dentistry, to execute surgeries, and it's also very commonly used in all the dental laboratories today. And we use it for recall and appointments for the comfort of the patients and to make the clinic functioning very efficient. And also it is used in institutions to educate the students very effectively. So
Yes,
it
I
is
think,
already there in our branch.
Yeah, that's a very good point because even yesterday, I think you were able to experience virtual reality. So automation and robotics has started becoming part of education, and it is really enhancing the experience of students who are learning these skills. So, since you have told about the influence of these in various aspects, can you just elaborate on that, Dr. Suresh?
So to look into a more elaborate or deeper way, automation in dentistry, as I said, is already happening. Most of us know. So in the diagnostic part of dentistry, AI plays a very good role. It will analyze the 3D scans very efficiently. And if you input the 3D scans and the patient's history, it can suggest you the diagnosis, the treatment, and it will also improve the accuracy of the treatment plans. It will help you to execute very accurate treatments. And you can also use AI or automation to educate the patient more efficiently. And for example, if you take intraoral scanners, which is commonly available in all the clinics, almost all the clinics, it has got integrated technology called optical coherence tomography. In short, it is called OCT. It is a high resolution scan. This can give you, help you to diagnose dental caries in a very early stage without invasive measures. And also very important today, especially in our country, to screen oral cancers in the very early stage, automation and robotics can be used. So like saliva samples, which is coming up in a big way, in future is going to be AI through samples from the saliva to detect early stage of cancers. And it is very efficient. It can give you the diagnosis within 10 minutes. And also, the automation will help us in digital workflow. Like even if you are delivering a crown, from the diagnosis, crown preparation, to making the crown, fixing the crown, everything can be seamlessly aligned by this workflow, digital workflow.
Yes, I think, as you said, the oral cancer screening is going to play a vital role, especially in our country where screening camps is going to be one of the main places where we detect cancers early. So instead of asking the patient to come to the institution or the hospital for doing a biopsy and then getting a result right there with a screening, utilizing artificial intelligence is going to be a big step for us for sure. So in implantology also, this AI automation has taken big steps in the last few years. I will just tell you a few points and then elaborate on that in the next few slides. First thing is the CBCT assessment and planning. The AI application has made big changes in that area. And now we are moving towards robotic assisted implant placement. And thirdly, predicting surgical outcome. The use of AI is become instrumental in getting predictable surgical results. So, Dr. Suresh, just to get the message across to our students, can you tell us how AI makes an impact when it comes to, let's say, a basic investigation like OPG?
Probably through our experience in the past and the present, we will be able to convey the importance of AI now. Those days when we used to plan for implants, the tool what we get is only two-dimensional X-rays. For example, they will give an OPG and tell us to plan. So nothing can be evaluated so efficiently from this kind of X-rays. The height, what we can measure in the X-ray, in the OPG also may not be correct because there is a magnification factor involved, and the width of the bone, alveolar crest, can never be measured in the two-dimensional X-rays, and the bone quality, nothing is possible from two-dimensional X-rays. But after the AI has set in, the AI era now today, you have softwares, multiple softwares which are available. So feed your patient's data, may it be your OPG or CBCT. The software will tell you what is the condition of the remaining dentition. If there are already implants placed for that patient, it will also tell you what is the status of the implant and the crowns. And it can also will let you know how many more implants are necessary, and the implant size can be evaluated preoperatively in all three dimensions, and also the quality of the bone can be efficiently measured through these softwares. So AI era is definitely a gift. You are all very lucky. You are going to use this in everyday practice. It's going to be very good, useful for you.
So just by scanning and feeding in the investigation like an OPG, the application actually detects for you the different pathologies and things that you might miss during a busy schedule and other things. So that is a big change, that the artificial intelligence never skips a finding, but it took a long way for this to reach this current application status. I'll just show you what I mean. See, way back when we used to learn programming in school or whatever, or when you see an image, the computer only used to recognize pixels, and it used to just allot grayscale numbers to that. So there's nothing more to that. But what changed and made AI so effective is the conversion of this pixel data into something what we call as image segmentation. Okay? How is this possible is what is the most interesting aspect of image processing. Earlier, as you saw in the earlier slide, it used to only see them as pixels. Nothing more to that. The machine just picks up pixels and notes grayscale to it. But the moment the computing power started increasing, right from the time when I'm sure you would have heard about kilobytes, now we are at the computing power of zettabytes, which is 1 part to 21. Once the computing power became higher, the observation was better. So they were able to pick up pixels, and then when these information was fed into mathematical algorithms, it started finding patterns. So that's what you can see here. If you take a simple image like a street image over here, you will see that the computer actually separates it out as at least 3 kind of segmentation, and then this is actually doesn't stop here. It is then fed into a system, and it will keep observing. Okay? So the message that I want you to take from this slide is that how computing power changed how computer observes an image from just pixels to patterns because of image segmentation. Okay, the biggest leap that actually gave birth to artificial intelligence is this paradigm shift from programming to machine learning. Okay? This is a very key point because as doctors, we don't understand. We just see companies coming with new technologies, but we don't know what led to these kind of inventions. So this paradigm shift is the most important thing, where programming to machine learning. Okay? In a simple flowchart I've just shown here, that initially when programming was the mainstay, data used to be fed in along with the program, and you get a desired output. So this is a very narrow-minded approach towards any application. But what changed is what is called machine learning. You can see the shift here, that from data and the desired output is fed into the system, and because of the machine learning inbuilt in the system, it gives you the program. Okay, so this is what changed the whole thing. Okay, there are books about neural networking in computers, which is embedded in systems, and now because systems have become too small for getting in those algorithms, they have shifted to cloud, where they have unlimited computing power. So you can see the next slide, next flowchart over here, that whatever program they generate, it doesn't stop there. They feed it back into the loop as new data, and then again it generates a new result. So it never stops. It's just like as clinicians and surgeons, we never stop at improving what we are doing. So just like that, this machine learning never stops. Each time it gets a new data, it puts it back into the algorithm and generates something better. So this is the main paradigm shift that we have in AI. So other than that, I told you what machine learning is. They have methods to make that machine learn by unsupervised learning, supervised learning, and reinforcement learning. If you actually look into this, it's very similar to how we learn or how human beings learn. You are actually given knowledge, you process it, and you start applying. And each time you apply, if I find some errors in your diagnosis or application, then you relearn things from your seniors or somebody who supervises you, and you get better. Similarly, the same way the machine learns, and that is exactly the model by which machine learning progresses. So now I would like to ask Dr. Suresh, so with this knowledge that we have about programming and machine learning, can you just take us through what is intraoral scanner and intraoral camera? Because both are visual devices, but
Yes.
does totally different jobs.
Yes, Sri Kumar, as you said, these both are digital data, intraorally done. Sorry. So we all started with the right side image, that is the intraoral camera, which was used mainly or being used only for the diagnostic purpose or to educate the patient. When you take a picture and then show the patient, they will understand, especially problems in the hidden areas like second molar, if there is a caries, class 5 lesions, they may not be able to see, but if you take a picture in the intraoral camera and then show it to the patient, they will agree there is a problem, they will be willing for the treatment. But it's not enough for us. Being a dentist, we need to do more with the technology. So we slowly shifted to intraoral scanners, which are more sophisticated, and technology-wise, they are more upgraded. So what we can do is, if you scan the oral cavity, for example, if you prepare a crown, the crown preparation can be scanned rather than taking a physical impression. You scan it and send it to the lab. The lab guys can design a crown digitally on the intraoral scanner image, and then they will do a printing or milling based on the requirement. So from intraoral photograph to the intraoral scanning, there is a huge difference. This is only for education purpose. The other one is for the workflow. From starting to the end, we can use the intraoral scans to finish our treatments. So because of the intraoral scanners only, we are able to provide the patients the same day treatment options. Like if you prepare the crown within 4 to 5 hours, you will be able to deliver the crown because everything is easy. There is no pouring models, there is no plaster of Paris or stone involved. So do a digital scan, do a digital design in the computer, which takes about 15 to 20 minutes or maximum half an hour. The milling takes place based on the machine what you use, probably from 2 hours to 4 hours it is done. And then you just have to cement the crown. So it is that easy now. So technology has taken us so much forward.
So I think we are coming to the end of taking impressions with alginate or addition silicone or whatever. So this is even applicable not only for oral implantology, even for orthognathic surgeries and other surgical planning. The same scanner, but a larger version of it is used to scan the face, and that is integrated into the intraoral scanner, and the rest of the workflow is the same. So as Dr. Suresh, you have told me that since intraoral scanners become such indispensable in our daily practice, they are trying to now diversify and get more applications with the intraoral scanner. One thing that is coming up now is called the detection of dental caries with the OCT technology. Yes, and I think that's what Dr. Suresh has already told. And then this is again what he had mentioned, either with biomarkers from saliva or even with better scanning methods, taking the image and then segmenting it and seeing similar patterns of how we diagnose malignancy with everted edges and other things. It will be able to segment and tell whether this looks like cancer or not. and then we can take it up for a biopsy or anything. And this is very useful, especially in screening camps when the maxillofacial surgeon might not be there in the camp, but these images actually can be utilized to screen and detect cancers at a very early stage. So the same image segmentation now, when we use it, we call it CBCT segmentation. So there was a time when we used to get these denta scans. It used to be all in cross sections, and it'll come in a film, and then we'll sit with a scale and then start measuring them. It used to take few minutes for a small case, and for a full mouth, it used to take a few hours for us to measure and find the angle and all that. But now, when you have CBCT taken, you have to feed it into an application which will be AI empowered, and then within a few seconds or minutes, it gives you the treatment plan with safe zone, where the nerve is, where the sinus is, what you have to be careful, and other things. So you can imagine what used to take a few hours takes a few seconds for us now, and what we need to do is to just check whether what it's generated is okay or not. Okay? Yeah, I think Dr. Suresh, I need you to help me elaborate on the data integration part, because it's on different platforms like CBCT. We used to have intraoral scanners, all are in different files. Now integration is possible.
Yeah, correct. So we have softwares today which can combine all the data. Like when you take a CBCT, you will see the bone better. But if you do an intraoral optical scan, you will see the soft tissues better. So combining these data into a software, it used to be difficult, but you have softwares, good softwares right now available, which are very useful in the field of orthognathic surgery and implantology. If you look at the left side diagram, you can see there is soft tissue. Inside you can see the bone, the maxilla, mandible, zygoma, everything, and also the teeth, which are captured by the intraoral optical scan, is all integrated together. So the analysis becomes easier and your treatment planning becomes easier. So you can consider both the hard tissue and the soft tissue to execute your treatment. On the right side, it's the same. You see everything, the soft tissue, hard tissue, the teeth, which is very useful for implantology planning and as well as for your orthognathic surgery.
That's very interesting, because there was a few years back when we used to have a DICOM file and then we used to have STL files. We'll try to merge it. It comes, they'll generate some kind of an image, but it'll never be accurate. So when it comes to right from making surgical stents or planning your prosthesis, you cannot never rely on it. So we used to waste a lot of intraoperative time trying to adjust them. It's all because of the errors that were incorporated because of the different platforms that were used. But now, this has become very precise. It's become very predictable. So because of this predictability, a large part of the surgery has shifted to what is called as guided surgery with the use of splints. This is the basic level of guidance that you can get with the use of technology. So there are stackable guides which will tell you how much to trim, how much of alveoloplasty and other bone reduction that you need to do first. And then you keep another splint on top of it like a stack, like you can see here, the green and the pink one. And then you can do the next stage of surgery, which might be implant placement or the like. And then because of the integration of data, from the earlier slide, you could see even the facial scans are done. So even the prosthesis can be planned pre-op. And at the same day of surgery, you can give the prosthesis. So this is a big leap for people. You know, like when we started, we used to just place implants and then wait. Then we used to take impressions and then send it to the lab. It comes back. So it's a long process. But now there are surgeries that are done as quick as 20 minutes, where all this is done at one shot. So this is a big leap, and that we wanted to share that with you, that you might be doing that right away. Okay, that's come after so many years of improvisation. So for these guides to be that predictable, the game changer was 3D printing. So Dr. Suresh, can you just tell them what the difference is and help us with that?
So as you just mentioned, the 3D printing has revolutionized the implant dentistry. Because whenever we start practicing implants, we generally tend to do it freehand. That is, open up the flap, place the implant, and then close. If it is a single implant, it's never a problem. But when you use more than one single implant, we need to be very accurate in the parallelism so that insertion of the processes and the biomechanics are in your favor. So for that to be executed, the parallelism, without damaging the adjacent tooth root and the anatomical structures, we need to have these 3D printed splints. This is how the technology helps us to print 3D models. So, and the gates. So, if you have a surgical gate, 3D printed surgical gate ready, you just place it inside the mouth just before surgery and then use the guiding holes which are provided in the 3D printing. When you use the drill through these openings, then whatever you have planned in your software pre-operatively can be executed 100% thoroughly in the, during the operatory time also. So you don't have any problem in preparing the processes and inserting it, and there is no chances for biomechanical failures, and also there is no possibility, almost no possibility to damage any anatomical structures. So 3D printing and the gates are so much
very
important
useful for
today,
us.
especially multiple implants.
So, as we are speaking this, there are two types of fabrication, if I can just tell you. One is this additive technology. That all comes under 3D printing. So what you can see here, just in the short video that I just wanted to keep you oriented on how a printer looks like. This is very similar to a normal printer that you have at home. It's a 2D printer. Okay, so when you make a 3D printer, this is what it is. So you can see this is a video of aligners being made with the 3D printing technology. You can see how the material is getting printed, like how a paper comes out of a printer. Amazing, just amazing. Okay. So can 3D printing be used for every process that we can make? That's not true, because long term, the material used for 3D printing, because it's additive, it's not got enough strength. And I remember my teachers and some researchers telling me the environment in the mouth is very similar to space environment. It has changes of temperature, there'll be compressive forces, there'll be tensile forces and all that. So there was a researcher who was my senior who got a patent and started working with NASA because of a specific polymer he made. You can imagine the polymer that he found out was used for a shuttle mission. So that's one time when I really felt, okay, in the whole body, the mouth is one kind of environment that can actually compare to rocket science. Okay, so coming back to this, if you want a process that is going to be sturdy and not have any kind of a deformative or stress changes, then you should use what is called as CNC milling, which is going to be a subtractive technology. Earlier we saw the 3D printing, which is more of additive, okay? Either powder or liquid powder, whatever. It sprays and creates it. While this one is subtractive, it mills. So that's why it's called milling. Initially it used to be, it's a numerical control, okay? So, and it has to be very precise. So this is very similar to what they use for making rocket, missiles, and other payloads that are there in the rocket, because it has to be that precise. Because I remember reading Abdul Kalam's book, and he said, if you have to make a rocket, imagine you'll have to make a bow hit the bullseye, which is 2 kilometers away. So even if it goes a little away initially, by the time it reaches the target, it is way off course. So that precise machining is needed, and that's when the CNC machining comes in. So you can see both one of the machine is the laboratory machine, and other thing which is a great advancement is the chair side. So this thing, we can actually have it in our clinics, where Dr. Suresh was telling about milling of a crown or a prosthesis, small ones, not the big ones. Big ones has to be still taken to the laboratory, where you can do that and deliver the processes in about half an hour to 1 hour. So that's much is the amount of advancement that has come as of now. So I'll just show you how the machine works. I hope there's audio to this, is little entertaining. So this is the block where the CNC machine mills the crown or the bridge for you. This should take about half an hour. So it's a time lapse. When I'm bored during the day, I go and sit and see. It's very entertaining. I keep music also. This used to take 4 days or a week when we send it to the lab, and by the time it comes back, with errors. This is hardly any error if you use the right system. Okay. So we're just doing this presentation like a progression, okay? Once all these became so predictable, okay, so we started, we were able to create precise 3D vectors, okay, through the AI-powered applications. And as Dr. Suresh, he was telling about how the data can be synchronized without error, and then you predict and make precise 3D vectors, which gave birth to the next technology that we already have. It's called navigation surgery. A little new for us, but started way before in the medical side. I think Dr. Suresh, can you just elaborate on this?
Yes, I'm a very big time fan of this navigation implantology practice. I do have a machine with me. So we have just seen the 3D prints or the gates for implant placement, which are known as static gates. So there are some shortcomings, like you need a special kit of burrs, which should be longer when you use a static gate. Also, the irrigation during your implant drilling is not adequate when you use your static gates. So to overcome all these disadvantages, now we have started using dynamic gates, otherwise known as navigation system. So here we feed all the data, the bone, soft tissue data, everything into the computer or the navigation system. When you start doing the implant drill, there is no static gate printed already. We don't have gates. We just open up the flap, we start doing the implant placement. When you do the drilling, the handpiece, what you have, is actually integrated with the navigation machine, and it will recognize your patient and the surgical site. It will keep guiding you in real time, whether you have started the implant drilling in the right place, what you have planned earlier or not. If it is not started in the exact place where you have planned, it will tell you how much deviation is there to move 1 millimeter distal, 1 millimeter medial, or 1 millimeter lingual or buccal. Everything, the site of drill beginning will be told by the navigation system. Another important thing is, when you deviate your planned angulation by even 0.5 degree, the navigation system will tell you you are already deviating by 0.5 degree and in which direction you are deviating. So it will tell you how to correct it also. So this is a real-time navigation. While you do the drilling protocol, it will tell you how to correct it, what is the amount of deviation. Also, there is a warning which is integrated in this system. Like if you go very close to the nerve, then it will tell you you are already closer to the nerve, you can stop. There will be an orange alert. If you go beyond that, you also have a red alert where you have to stop the machine drilling process. So all that is a huge benefit of navigation system. You have various navigation machines. You can buy one based on your need and the cost factors, but they are really useful to do your implant practice.
So this is just, as a common man, I can ask you, is it like a Google map for the implant?
It's almost like that.
Okay, you put in the destination and it takes you there.
Yes.
And it's real time. As you saw in the video, you move it, it will tell you whether you are in the green, yellow or red zone. You shift it and you can do it. So now, the moment this technology came a few years back, it actually gave me alarm bells, because they're taking out the human factor, but just using our hand, and then we can do this. So I was just talking to my friend Dr. Naveen, see, this has come. In a matter of years, something else is going to take over that. Okay, and that's anyways come into this thing. So before we go to the next aspect of the presentation, so even though we feel robots are what you see in this picture over here as humanoids, what you saw earlier are also kind of robots, just that they don't have the mechanical aspects to it. They're all in software. So the concept of a robo has to change for us because we have already been into robotics and this thing, just that we didn't have the mechanical extension of the automation. So that is one concept that I had to reframe in my mind once these technologies started coming in. So right now, even as I'm speaking, there are AI-driven robotic surgeries and the robot arms are assisting in scaling, root canals, extractions, crown placements, and it plays a big role in training and simulation. And this is the thing that actually created waves in our field. Dr. Suresh, can you just, because it's a very interesting thing, yes. I want you to just tell them about this.
Yes, we think robots are very new to the field, but there are already researchers, especially happening more and more in China, Japan, and the United States of America. They have invented many robots. The one which we are more familiar today is called Yomi robotic system, which is developed by the Neosys company belonging to United States of America. If you look at the data, it will be very surprising. It is already FDA approved, cleared, and it is very useful in giving us the real-time haptic feedback so that we can complete the surgery without any flaw. And the data says there are already 60,000 implants which are placed using this robo. So it is happening for quite some time, and it is not a hypothetical aspect anymore. They have done quite a few researches, and the research papers are already out. They have compared the manual implant placement with this robotic implant placement. The results show the precision is much, much better when you use a robot to place implant. So the data is very strongly suggesting us to use robots, at least in the future, to execute better treatment.
Yeah, so there are peer-reviewed articles coming out.
Yes, it's already out. Yes.
Exponentially saying that these are better in placement.
Correct.
And shall I play the next thing? So
yes,
I've got the video also, you can just see. Sure. I have not used the Yomi Robo as yet. Dr. Suresh, have you used it or is it come to India? I'm not sure about it.
No. I have not used it. I have read it. I have seen the videos. I have read the articles. They are very, very encouraging actually.
See, the earlier things that we talked about, we are already doing. But this is a new thing and we are finding it to be very impressive.
Correct.
So this is how it looks. So the only difference is that when I told about the navigation surgery, you have to hold the handpiece. Okay? Here, the Yomi holds the handpiece, but there's still some good news. I'll tell you later.
The only FDA-cleared robotic system for dental surgery. Yomi is an end-to-end robotic platform with planning, surgical, and restorative features. Working with Yomi includes 5 steps for every case: link, scan, plan, surgery, and restore. First, Yomi Link establishes a physical connection to allow real-time patient tracking, linking the physical anatomy and digital representation.
Similar to that QR code that you saw in navigation.
A variety of Yomi Link splints can be used for partially and fully edentulous patients, where radiopaque markers allow us to create reference points and register to the patient's anatomy. With the link in place, we use a same-day scan to determine the exact location of the implant placement relative to the patient's anatomy. The scan is then transferred to the Yomi robotic system for surgery. Our Yomi Plan software guides you through surgery and restorative planning, including complete integration with the robot for maximum accuracy and efficiency. Once the surgical plan is finalized, the Yomi Plan software walks you through the steps of the procedure. During surgery, the tracker gives real-time position data for live patient
robo
tracking
moving along
and
with the
surgical
cast
precision.
when it moves.
The guided surgical approach involves correcting angle and position to match your plan. Then, Yomi locks into guided mode. While in guided mode, you control the handpiece, while Yomi physically prevents off-plan movement and stops the drill at the planned depth to ensure accuracy and safety. Yomi precisely guides osteotomy and implant placement for fast and predictable crown restoration.
Dental providers across the country have performed over 70,000 osteotomies robotically with Yomi and counting.
Every 6 minutes, an implant is placed with Yomi. A 2-year comprehensive study has proven Yomi is more accurate than freehand, more accurate than guides, and more accurate than navigation. Learn more about Yomi, haptics, and the impact of the entire.
The good news is still we have to hold it. It'll move. We'll have to hold it. So, see, all these robots, even though we know that it is very advanced, among robotics, the whole field of robotics, it is still in level 2. Still level 2. So that means, I'll tell you the classification little later. But robots have been used very extensively in the medical field, in the surgical field. And one of the most convincing and the most predictable and the most comprehensive one is this thing. Like Dr. Suresh told, there are many robots. I'm just showing you one which is more popular.
Advanced platform for minimally invasive surgery available in the world today. The integration of high-resolution 3D vision, wristed instruments, and intuitive motion control enable the Da Vinci surgeon to transcend the limitations of conventional surgical technologies. 3 network components comprise the Da Vinci surgical system: an ergonomic surgeon's console, a patient-side cart with 4 interactive robotic arms, and a high-definition 3D vision system. Seated at the console, the Da Vinci surgeon views a remarkably clear 3D image of the surgical field. The system scales, filters, and translates the movements of the surgeon's hands on the master controllers to 4 interactive robotic arms on the patient cart. The precisely controlled micro-movements of the Da Vinci instruments are enabled by the computer processors of the system. These dedicated processors perform millions of safety checks over the course of a procedure for enhanced surgical precision and control. Da Vinci EndoWrist instruments are designed with a unique wristed architecture that provides 7 degrees of freedom for a range of motion greater than even the human wrist. This proprietary design enables surgical maneuvers impossible with conventional laparoscopic tools. The system requires that every surgical maneuver is under the direct control of the surgeon. Redundant safety checks prevent autonomous movement of the instruments or the robotic arms. The Da Vinci S surgical system moves surgery forward with a new level of technical capability that enables minimally invasive surgery in complex procedures as never before. Da Vinci provides a streamlined surgical experience that benefits the hospital, the surgeon, the OR team, and, most importantly, the patient.
Yeah, at this juncture, I would like to tell you, the topic is robotics, automation in oral implantology. The organizers, Dr. Naveen, the whole MaxFax team, has actually done this like a very, spoon feeding. It's like a small step, because the possibilities of navigation and other technology that we use is much more in maxillofacial surgery, which would have been much bigger lecture, much greater possibilities. But if that's been presented, it'll all go over your head. Okay, we'll just walk off, because you've still not got that orientation. So, very nicely done program so that it will reach you well. Okay, many a time I find that when it's not reaching you, you will not take it. Okay, so this is like a small step saying that, okay, this is really there, and there are much more possibilities for you if you pursue this specialty. Okay, the fruits are there, but it'll take time to ripen. You have to just be patient and mature. So that's a great initiative by the department and the association. I would like to, really congratulate that initiative. And coming back to the lecture, So there are other robots, as Dr. Suresh was saying, which are being used. One very popular that you will see is this KUKA. That's being used even in automobiles and other industries. So when compared to our field, the automobile field, the laboratory research field is way ahead. And I think I've heard about 70–80% of their assembly lines and process have been taken over by the robots. And these, all these robots that we saw both in the medical field and in the automobile are called cobots because they are collaborative robots which help us to do the work better, more efficiently, and more safely. So all these are called cobots. Still, I will say all these are level 2. Level 2, okay? So let's say, I'm just telling you, okay, what these levels are. So even though you have a lot of classifications in robotics, the most practically what we can say is that they have these levels called 0 to 5. You can see from this that level 0 is the robots have no autonomy, while level 5 have full autonomy. That's the difference. And you see the last column, you will have full manual control, and to the end you have none. Okay? This shift is happening in every field. From no autonomy of robots to full autonomy, and full human intervention to none. Okay, so it's a ticking time bomb. But it'll inevitably reach.
Exactly.
Right? So there's level 3. I just wanted to show you an example. Most of the automobile versions are coming with level 3 now. I'll just show you. No driver in the seat. This is level 3, still not full autonomy. This is 2025. It's going to come out very soon. So they've kept the steering wheel still there so that even in the most adverse situations, it will give a beep and then you can take over. But otherwise, you don't need to. It will do all the rest. So from the Google Maps that we used to use, now it started turning on its own. Earlier it used to have assist, and now it's got this. So that's level 3. Some operation systems have gone to level 5, which will be telecommunication networks. There are few Google networks.
Sri, just a moment, if I stop you.
Sorry.
Is that already there in India, this driving in slow traffic, auto driving?
It is coming.
Because even today when I was driving from Annanagar to Ramachandra, I had to scold 100 people and 200 people had to scold back to me. So the traffic is killing. So if this can happen in India, especially in Chennai, I think it's going to be really good.
I'm sure it will come.
Yeah. Please go ahead.
Okay.
Sorry.
So the level 5, as you know, few systems have reached it. One is telecommunications, where right from complaint registering to taking care of it, prediction of it, all things, there are no people in that building. It's fully autonomous. So that's where we are heading. But so there is this another autonomous robot that has come. This I just wanted to show you. It was very interesting to see that. This is it's called a Passi robo for making pizza in Italy. Fully automated. It learned from one of the best chefs in Italy on how to make pizza. It had training for about 6 months. Different recipes it learned. It takes the ingredients from the shelf on its own, makes everything, orders the ingredients back. It's being delivered by Amazon or Google. Into the thing, it checks its inventory, everything, all done by one robot. 2 arms. So I saw myself sitting here than in the clinic.
That was more satisfying. I think you have spread the concept of Passi robot rather than anything else in dentistry.
Yeah, but that's just on the lighter side, but there are a lot of applications. Dr. Suresh, please can you? help us with that.
So, having discussed broadly about the automation and robotics in dentistry, especially in implant science, we do see a lot of benefits by this technology. This offers us to do treatment in a large scale. That is, if you want to treat 400 to 500 patients a day, we can use robots. There is no human fatigue, and it is still possible to treat huge number of patients. And also, it makes it possible to do treatments in the remote areas where you may not be able to go personally. You can employ the technician and the robot to do the treatments. You can get from a distant place, and the precision through treatment is quite amazing, and we have scientific papers published on it. So the results are very, very encouraging and very strong. And also, it is easy to train the robot. Like, it's not like your UG or PG student. Every time you have to say, do this, do that, don't do this, don't do that. Once you command or instruct the robot to do that, till it gets repaired or spoiled, it will do the same thing without any micro deviation. So that is the huge benefit of using robotic technology. So the future tells us to use this automation and robotics. It's already there. It is nothing new. It's already there, happening around you. So it is your duty to imbibe it in your future practice. That's what is the message we want to convey to you. And there will be a question in your mind by now. If robot is going to do everything, what is my role? So the robot can do anything based on your instruction. So you can have any robot in your practice, but only you feed the data, and it is going to work. As Dr. Srikumar was telling, we are still in level 2. To reach level 5, that is fully automated robots, it might even take 100 or 150 years. Only your grandson or granddaughter will be able to use that kind of sophistication. So till so long a time, you are going to own the robot, and you are going to guide the robot. So do not worry about the unemployment. You can use your robot to make your treatment protocols more efficient, more precise, more safe. That's what we want to convey. And I would like to thank for choosing this topic, the team, OMFS, Ramachandra Dental College, Professor Dr. Ravindran sir, Dr. Naveen, the HOD, and the entire team of OMFS for this, giving me this topic. Like, we read a lot, me and Srikumar, we discussed quite a lot, and we could learn much more things, new things by giving this topic. I sincerely thank for this opportunity. Thank you. All the best.
Thank you for your thought-provoking oration on robotics and automation implantology, sirs. Your perspective brought clarity to a rapidly evolving frontier in clinical practice. To felicitate Dr. Srikumar sir and Dr. Suresh Kumar sir, I would like to call upon Professor Dr. Ravindran sir from Department of OMFS, Sri Ramachandra Dental College.